Should I ask about anesthesia options during my consultation? When you're considering plastic surgery, it's natural to focus on how you'll look afterward. But a key part of your experience is what happens during the procedure itself. Asking about anesthesia options during your consultation is very important. It helps you understand how you'll be kept comfortable and safe throughout the process. Anesthesia is what prevents pain during surgery. The main types are local anesthesia, sedation, and general anesthesia. Local anesthesia numbs only a small area, so you stay awake but don't feel pain. It's often used for minor procedures like small skin removals or some liposuction. Sedation, sometimes called twilight anesthesia, involves medications that relax you and make you drowsy or sleepy. You usually breathe on your own and won't remember much about the procedure. This is common for surgeries like eyelid lifts or brow lifts. General anesthesia puts you into a deep sleep and you're completely unconscious. You'll need a breathing tube, and it's typically used for more complex surgeries like tummy tucks or full facelifts. Asking about anesthesia options is essential because it influences your comfort, recovery, and safety. Not every procedure requires the same type of anesthesia, and not everyone is a good candidate for all options. Your overall health, the complexity of the surgery, your medical history, and your personal preferences all matter. When you ask your surgeon about anesthesia, you can learn what to expect during and after surgery, discuss any worries about being awake or asleep, and understand potential side effects or risks. During your consultation, consider asking questions like, "What type of anesthesia do you recommend for my procedure and why?" Or, "Are there alternatives to general anesthesia?" You might also ask about risks, how pain will be managed afterward, and what recovery will look like in terms of anesthesia side effects. Your surgeon and anesthesiologist will review your medical history, the specifics of your surgery, and your preferences to recommend the safest choice. Some patients prefer to avoid general anesthesia because of concerns about nausea, longer recovery times, or needing a breathing tube. In these cases, sedation or local anesthesia might be options, but it depends on the procedure and your health. For more extensive surgeries, general anesthesia is often the safest and most effective way to ensure your comfort and allow the surgeon to work efficiently. Remember, the final decision about anesthesia should be a shared one between you and your surgical team. Always share any past experiences with anesthesia, allergies, or health conditions that could influence your care. Asking about anesthesia options is not just a good idea. It's a vital part of planning your surgery safely and comfortably. Taking the time to discuss this helps you feel more confident and prepared, making your entire plastic surgery journey smoother and more positive. Always consult your healthcare provider for personalized advice tailored to your specific health needs.